So this is an 18-year-old quarter horse who had developed some recent head shaking and some intermittent mucoid nasal discharge from her nostril. This is a dorsal multiplanar reconstruction. Sagittal, transverse, and here we can see we've got this very round, well-marginated structure. I'll play this one more time. And you can see that it is closely associated with those ethmoid hematoma, or sorry, with those ethmoid turbinates, perhaps extending into it, perhaps that's just some confluent fluid, and then we have some fluid in the surrounding sinus. So interestingly enough, this mass did not have that kind of hyperdense or hyperattenuating swirling appearance, very, very round compared to those other ethmoid hematomas we just looked at. And so we felt that this was more likely going to be a cyst compared to an ethmoid hematoma. We did take the horse to surgery, did a frontonasal bone flap, and it was determined to be a cyst and removed in its entirety. They cultured the fluid, it was negative, there was no growth, and kind of flushed things out. The horse did well. It did have, came back I think about 6 weeks later, it did have some facial suture periostitis, but was otherwise doing pretty well. All right, I think this is our last paper here. So very recent, this is 2020 out of EVJ. So they looked at CT characteristics of equine paranasal sinus cysts. And so quite interesting, they found that a lot of these cysts had this hyperattenuating wall-like structure, and this is pre-contrast. And then they did not have that kind of hyperdense swirling that we saw with the ethmoid hematomas. The other thing that I thought was quite interesting in this paper was that when they looked at the Hounsfield units of the material within the cyst, there was no real significant difference in those values when comparing to other sinonasal diseases. And so the thought would be, perhaps that's really more fluid filled, and so we should have a difference in our Hounsfield unit, which perhaps could have helped us order our differentials, but there was no significant difference.